Hello, I am Becky Choi, your postpartum corrective exercise specialist. So today it's beautiful weather here. I decided to come out and film a video because it's October on the weekend and it's like still really sunny and hot. I'm so happy. Like this is the fall that I want in Canada. But yes, so I get a lot of questions in my DM of course lately and I keep them coming. I love it. And if you haven't followed me on Instagram, please follow me at BeckyChoi_ and also subscribe to this channel if you have been finding this channel useful for you. So I do get questions daily about what kind of exercise should I be doing for diastasis recti? How do I get started? What exercise will target my belly? What exercise will straighten my belly? What exercise will heal my diastasis? So you get the point. So everybody wants to know exercises. And of course, I have had some exercises in my channel. There's exercises there. But I am planning on, and you will see it soon, I wanted to put more exercises in the channel. Those are work-along video exercises that you work alongside me to do the exercises together. Now, I do wanted to say that though, healing diastasis recti is not just about exercises. It's about a whole body issue. It's not just what exercises. If it's just exercises, then I'll tell you, okay, dead bug, pelvic tilt, leg lift, side plank, right? Those would be the exercises. But the most important thing I wanted to tell you, when you are not sure where to start, maybe you have been trying exercises that you have been doing, let's say weightlifting and cardios, and maybe you have been doing some HIIT or some gentle, the core exercises I was telling you earlier, then I want you to start doing breathing exercises. And I will have breathing exercises to work along video that you can do soon. Now, you could go to do that, but listen to me before you go do those workouts. When you work on the breathing, you are allowing your breath to go into the right places. That is called the mind to muscles connection. When you're trying to engage your core during those core exercises, you might not be engaging your core correctly. You might be thinking you're working on the deep transverse abdominal muscles here, but you're actually only engaging your upper abs, or maybe you're only using your side obliques. You might not be using the deep core muscles. So that's why going back to breathing will help you be in tune with your body. It's like primer, right? You need to primer on, and then you put foundations on, so then your skin looks better, looks healthier, and the primer acts as a barrier so that the foundation will sit longer and it'll be more lasting for you. Similar to, I guess so, yeah, similar to working out on the diastasis. I know exercises are important and probably everybody's talking about best exercises, 3 top exercises. This is the only exercises you need to do to heal DR. But if your breathing is not correct, then it's so hard for you to engage. And when I'm telling you, okay, engage your core, what is your core exactly doing? Are you sucking up your belly, or are you just doing a kegels, or are you just using your upper abs and only doing the upper abs gripping and forcing pressure down? Right? So that's why you need to start with breathing. And so once you get the 360-degree breathing foundation right, then you can move on to do some core exercises. Because with breathing, you're able to expand your body. You're able to elongate the muscles that you need to elongate and to prep for the body so that when you engage, you can actually contract. So think of breathing as in like your fist here, and we are breathing, expanding. We inhale through our nose and then expand the chest, expand the side, expand the back. When you inhale, you expand, and then when you exhale, you contract, right? So if you're already in like a tense mode, because you're always sucking in your belly with or without knowing, maybe you're gripping your bum with or without knowing, because some people don't even know that they're gripping the bum all day, or they might not be realize that they're sucking in their belly all day because it's sticking out and they just suck it in without even knowing. And so they might be always in these positions already. And so when you go and do more core exercises, there's only so much room you can engage, and that's why it's not very effective. And that's why you need to prime your body, like you prime your face, prime your body, prime your core and your trunk, so that you can expand and contract. It's really important not to miss the step. And I see that many people just go straight into the exercises, right? And without knowing that, okay, whether they're breathing correctly, how their ribs are aligning, right? If you go back to a video where I talk about how to heal your upper diastasis, like you have an upper bulge, right? Maybe because you're shorter, your ribs are your ribs are flaring out, and your back is arching because you're shorter. You generally has a shorter torso, and so the whole area is rounded and bulging out. So that's why I would like you to get started on diastasis. If you have diastasis, if you just found out you have diastasis, you have been working on diastasis and nothing is working, work on the breathing. And once you're able to get breathing, and sometimes breathing could take a couple of days, a week, and maybe even a month or 2 months to really get it. Like some people, if they have not been breathing in a way that that they should supposed to breathe because through pregnancy and also stress in daily life after baby, you're always tense and you're always tending to the baby. You kind of forget about yourself, right? And it's normal. I was like that too. So you will need some time to be more in tune, mind to muscles connection with your body, so that you're able to breathe better. And then once you're able to grasp that, you can simultaneously work on the core engagement exercises and work progressively load your core in order for you to move on to more challenging exercises. And there's no point for you to work on pelvic tilt, kegels, or like a heel slide, leg slide, like those kind of exercises for like 2-3 months. When you are feeling that this is not really helping you and you're not challenging your core, there's no point on staying there. But there is a reason for you to start with the foundation stuff and then see how you feel and you move on. You keep on adding more challenging exercises that you're feeling that your core is tightened, that you're feeling your core is working out. So yeah, that would be the best advice I have for you when you're just getting started. And on top of that, your nutrition will be important. Working on nutrition to help heal your diastasis, to help heal your connective tissues, and as well as stretching for better body alignment, so that when you're performing the exercises, you're actually using the right form. And when you're standing, sitting, you're rocking around, you actually have a good posture rather than hang onto your spine or like you're slouching, pushing your body, pushing your bellies out. So because you only do half an hour exercises per day, right? But the rest of the 23.5 hours, you're doing something. And if you're not mindful of those 23.5 hours, then it's like a tug of war. You're doing exercise trying to heal it, but the rest of the 23 hours, you're kind of like, oh, la, la, and then you're like slouching or you're overarching. So that's why posture is also very important. Okay, so I hope that is helpful in the video here to explain why and how you can get started now. And yeah, if you are wondering more about diastasis, or maybe you're wondering how to work with me, then you can go on www.tummywarrior.com and we can chat more about your situation. I do one-on-one coaching and customize your program. So all right, thank you so much for tuning in, and I'll talk to you later. Please subscribe. Bye-bye.